A welcome break on a beach in Catalonia after an unprecedented lockdown would be difficult for most people to resist. But amid these relaxed scenes, an uncomfortable question is being asked. Is this the start of a second wave of the pandemic? On Saturday, almost 1,500 new cases were recorded in the region, most of them in and around the city of Barcelona. Many of the new cases are young people showing mild or no symptoms at all. It prompted a swift shutdown of nightclubs throughout the region, as well as a curfew on bars. And concern among other European countries of further outbreaks. The UK's government announced on Saturday that a 14-day quarantine period would be introduced for travellers returning from Spain. And in France, there were requests to avoid travel to the country altogether.
Concerning the situation in Catalonia, which is displaying worsened indicators for infection, where, as you know, those health indicators are deteriorating, we strongly encourage French citizens to avoid going there until the health situation improves in these territories.
This is the high season for tourism, and many working in the sector are already feeling the drastic impact of the pandemic.
In all the years that I have been here, this is catastrophic. Things were good for a time over the past weeks, but not now. Even 2 weeks ago, you saw more people out, but not now. There is nothing.
All over the country, towns and cities are once again closing up. After a much-awaited easing of restrictions, the lack of a proper track and trace system is prompting an increase in infections around the country. It was hoped that the summer would deliver a pause in the pandemic, but the contagious nature of the coronavirus seems to once again trump optimism of a respite anytime soon. Sonia Gallego, Al Jazeera.
Well, Dr. Bharat Pakhania is a senior clinical lecturer at the University of Exeter Medical School, and he explains the surge in the number of infections in Europe and in the US.
I personally feel this is a continuation of the pandemic rather than a start of a new wave. The number of cases only went down because we went into a lockdown. But when we went into a lockdown, the case numbers were down, but they were not zero, or they were not imperceptibly low. And what happens when the virus is out there in circulation, and then you start opening up things like nightclubs, socializing, meeting in restaurants, clubs, bars, clubs, etc., and pretending, and this is the important bit, and pretending that it's all over, let us resume because we need the economy to run. Unfortunately, we get this huge number of new cases created. We must accept that the virus is in circulation. We must open the economy, but we must be very, very careful. Why are we not doing this? It baffles me. I worry about the United States, United Kingdom, Europe, and the rest of the world. There has been a pressure from the economy side to open up. And I feel, for example, the United Kingdom opened up prematurely. And I feel the health and the economy should run together, which is we work together on how we open it safely rather than open it prematurely and unsafely.